Dr. Barrett.
Yeah.
Truth or trash?
Truth or trash?
You have to replace implants every 10 years.
It's kind of like in between. I recommend to replace it every 10 years because the rupture data is very low until about 10 years and then it starts to go up. So you can give the MRI and surveillance, or you can just spend that money towards a refresh of implants.
Implants always look fake.
Trash. Most of the time, at least in my hands, we can make them look natural. If you look at my website, you can see lots of natural results. So that is trash, depending on the surgeon.
You'll lose sensation in your nipples.
Partially true, yeah. So like you have to be careful, right? If you go really large with an implant, you're more likely to disrupt nipple sensitivity, right? Again, a lot of surgical technique is involved with that. If you do a lot of undermining and dissection, you can get a more likelihood of disrupting sensation to the nipples. Majority of the time, we don't have that issue. Depending on your incision, armpit, I generally avoid that just because of that nipple sensation, but you got to be careful.
Breast implants prevent you from breastfeeding.
There's truth and trash on that. So there's a certain percentage of women, according to statistics, that have difficulty or not able to breastfeed due to implants. A lot of people think because you have implants, you can't breastfeed. That's not necessarily the case. They don't physically stop you from being able to breastfeed. It's not toxic to the baby or anything like that. But sometimes extensive breast surgery can interrupt your ability to breastfeed. So another reason to go to a good surgeon who minimizes the dissection so it doesn't disrupt that glandular structure to the nipple.
You can't get implants if you're small-framed or athletic.
Trash. Proven. Done it. Looks great, natural.
Saline implants are safer than silicone.
Trash. I wouldn't say they're safer. The silicone implants are cohesive now, so the silicone doesn't run throughout your body. I think that's the main fear with silicone implants. Saline, if it ruptures, is like a flat tire. Silicone, if it ruptures, it is irritating for most people, but it's not this kind of big devastating thing where all the liquid silicone runs throughout your body. So, yeah.